to Mel and Z.
Woohoo!
Thank you so much for your patience. So today we have a special guest.
We have Indira Santana, boss woman, entrepreneur, business owner, all of the above, an amazing human being. She's with us today. Thank you so much for taking some time out of your busy schedule and coming to meet up with us.
I'm so excited to be here and talk about all the goodies we have today.
Yes, today we have an amazing topic, and it's something that a lot of women and men, but mostly women deal with. Which is menopause, and we're also going to talk about perimenopause because a lot of us don't know.
Because we're in it.
We're in it. We're currently experiencing some of those symptoms. And it has become, it's something that we've known for such a long time, but now is that people are starting to talk about it again. And we are here to talk about hormone replacement therapy and some of the benefits. And who else that can talk to us about it than this amazing human that's been working with hormone replacement therapy for over 8 years?
Yes. I've actually been on hormones for about 8 years now. I'm turning 40 soon.
Woo-hoo!
So definitely important to have this conversation that menopause is not just when your period ends, right? We think about it as just that, and it's a lot more.
Is that why I always sweat?
Yes, excessive sweats. It happens. It starts in your 30s. So I'm the founder of My Wellness Solutions, and we've been there for about 15 years. My focus really has been giving clients a more holistic way to health, right? Especially in our community, right? We're the ones who need it.
Amen.
Many times over the last, thousands of clients, hey, I have diabetes, and the first thing that they do is give you medication and not talk to you about your diet, right? Lifestyle is really important. Your stress, your nervous system, how's your digestion?
And that's unfortunate. I don't mean to cut you off, but that's how I was trained. And we spoke a lot about that in primary. I'm one. I am guilty. I am guilty.
You were one of them.
I was, exactly. And it's sad because this is how we are. Even in school, the first line of therapy, medication. It's not even everything else. And I was one of those who was always fighting not to prescribe antibiotics, not to prescribe medication. That's why I knew that holistic medicine was always going to be kind of like,
absolutely,
And
I think culturally, it's our initial go-to, right? Think about when you were sick, younger. Your mom is first a little bit of honey and a little bit of lemon and this and that. It's really in our immigrant experience that we start to put so much value in what the doctor tells you and not enough value in our cultural, like just our instincts.
Definitely, even myself. So when I'm going through things, I want right away, instant gratification, instant help. And so I'm like, where the meds at? Where the meds at? Yeah. Mind you, I tried 7 different medications to figure out the best cocktail, right?
Yeah.
So
and the goal has to be, there's a balance between both, right? Both worlds can and need to live together, right? They need to live together, right? We got epidurals to not go through the pain, right? So there has to be like this happy balance in between, but really it's about listening to your body, right? Because the goal has to be to get off the medication eventually.
Right.
Traditional medicine is, as Dr. Law can really say, it's how long can a doctor keep their patient on medication, right? When for us it's, do I still need it, right? You have to listen to your body to know, do I still need to take this? Do I feel good? And once you're able to listen to yourself and hold true to that, then...
And then at that point, now you're dealing with the side effects of the medication.
Correct. But do people really need it? This is the question. This is the root cause of everything. Does the patient really need the medication? Are we fixing the root cause of the issue? Most issues come from hormones, imbalanced hormones, right? So we're not fixing the hormones. We're not fixing anything. We're just putting a blanket on some of these medical conditions that could have been controlled just by a simple test.
And for women, as we said, yes, this conversation that we're having is really about hormones, but for women, we are likely to see 5 different doctors. You have your psychiatrist, you have your rheumatoid arthritis with the joint pains, you have your OBG, you have a therapist, you have this,
exactly,
you have that, and they're all gonna diagnose you with something completely different. You know, you'll be on antidepressants for years before you're like, wait a minute, this could just be hormonal imbalance that I'm having, like crazy PMS symptoms. And what hormone symptoms are, it changes, right? Throughout your 30s, throughout my 30s. So again, I'm turning 40. I've been on hormones for some time now. Throughout my 30s, it's been...
You still look 30.
It's a...
She's a baby.
By the way, estrogen is what keeps you young, bro. Estrogen is responsible for your collagen, you know? And so it's throughout your PMS, like your PMS starts to get worse, like your anxiety, your you know, maybe towards your late 30s, your sleep, irritability,
you don't sleep.
You know.
But that's the thing, a lot of folks don't know what are those hormones that usually are imbalanced when we start out our late 20s, because at 28, 29, every human on this earth that's walking, we start losing hormones. They start decreasing with age.
Yep.
We're not getting it back.
Yeah.
I'm just gonna let you know that.
No.
So
T is everything.
Testosterone, progesterone, estrogen, they are responsible for the mood, the weight gain, the irritability, your libido, your sexual drive.
Feeling like yourself. Like so many of our patients, right? It's like, I don't recognize my body anymore. All of a sudden,
Like,
you
who
wake
am
up,
I?
and you're like, what is this? And it gets like between 30, when you're that 40 mark, what I see in a lot of patients is it gets a lot worse, right?
Yeah.
In your 30s, you're like, all right, I can deal with this, you know? In your 40s, you're like, wait a minute. Guess what? Most divorces are happening
Around 40. Wow.
in
That's
our
deep.
40s.
That's
In
deep.
your 50s, you're out of control, but you should have already started.
Well, I didn't get to 40.
hormone therapy. All right, so we're not there. We're not there yet. We're not there yet.
Would you say it's too late at that point?
No, it's never too late.
Okay.
It's never too late. But hormones is also, when we think about longevity, right? I want to get to 80 and feel like I'm 30,
Yes.
right? The longer you are on it, the more you don't allow the degenerative diseases, Alzheimer's. Women are more likely cardiovascular. We're more likely to have a heart attack or stroke than a man. It's because we lose so much estrogen.
So would you say that you can reverse some things?
Absolutely.
Absolutely.
And it could work in a preventive way.
Okay.
Because a lot of the women that come to us, they start, you know, at their 50s and 60s having symptoms. They're like, I have bone pain. And we're like, well, your estrogen is on the floor and your T and everything. It's like on a negative 20. But yet they're taking all this other medication. It's like, that's not helping. We're not fixing the
cortisone shot in my back. I'm 36. Why? I didn't do anything. Well, I do fall all the time. But it's like, come on.
But you have to protect. You have to
Correct.
We have to think about like our aunties.
But probably she's low. She need a blood test. That's the first step to
And I
all of
haven't gotten a
this.
blood test and I don't even know how long.
But you probably did, but you
bad.
gotta understand the markers
That's another
that
one.
we do is very different
It's all of
from
the above.
the markers that we was doing in primary care. Like we were saying from the beginning, what they taught me in primary care is totally different. That's what a lot of people don't know.
Yeah, no, it's been so interesting. We've been working together for the past few months, and it's just, I know for her, it's also been like, oh my goodness, like, no, we have to look at all of these other things, and now her being able to see like symptoms matter. It's not about, you can go to your primary and your labs don't show anything wrong, but you feel
Like
all sorts of
crap.
things, right? What your doctor's gonna say.
Take this.
It is what it is.
You good.
Lose some weight.
Come back.
As if I'm not trying.
Right.
I'm not trying to lose
Come back in
weight.
6 weeks to follow up.
Come back. But that's
And it's the same conversation.
Exactly.
But it's not. They're not really sitting with you. They're not really having a conversation with you. They're having blanket conversations, and it's so unfortunate because it usually is women. You know, it's us. We're the ones that are Men,
Suffering.
they that's a whole nother episode, right? That's a whole nother episode because they deny symptoms that they actually do feel.
With everything,
Right?
with medical
Everything.
conditions, with symptoms.
But we say it,
We're feeling it, the hot
you
flashes.
know, like when you have a hot flash, or and we think hot flashes, we think super menopause. No, your hot flashes and night sweats can be a sign of imbalance in thyroid, which is another hormone. You know, vitamin D. Oh,
another
I'm
hormone.
vitamin D deficient. Oh, everybody, no, don't pay it. That's another hormone that is protective.
That's why I told you to take vitamin D.
Yeah, long
long
term in terms of emotions too. Vitamin D is super important. You know, so there's a lot of
Misinformation out there.
Misinformation out there, and the biggest reason is the big C word. You know, cancer. Oh, hormones cause cancer. And I hope everybody.
One of the
Googles
big
this
myths and stigmas. It's
Women's
terrible.
Health Initiative 20 years ago said hormones cause cancer. So you have 20 years of education to doctors, right? Where they're telling, no, don't talk about hormones and have this, and no, this is not it. And
Well, why they don't want to talk about hormones? Because they knew that if you fix the imbalancement of hormones in women, you're going to prevent all these cardiovascular Alzheimer's. That's not convenient. I hope we don't get putting this information out there. It's not convenient for the pharmaceutical companies. They're making, if we could have prevented all these women from having osteoporosis, arthritis, Alzheimer's, dementia. They don't want you to know that. No. This is why as we're going into our 40s, we're having, we're losing our memory. We have extreme brain fog, and, these hormones need to be replaced. They're not going anywhere.
There's nothing that you can take that is going to make your body start to produce this again.
Okay. Once it's lost.
It's gone.
Okay.
Adios. Finito.
We will cycle throughout the month some estrogen. There might be some conversion that's left there, but you are at your peak in your 20s.
Oh wow.
We are living to 100.
I thought at my prime was
God
30.
willing.
That's right.
God willing, we live to
That's a lie.
And if we're
your prime's in your 40s if you're balanced with your hormones, girl. It gets better. It gets better.
All right,
It gets
so
better.
I'm taking hormones now. I'm feeling great. Do I stop seeing all my doctors?
Oof.
Do I stop
What's
seeing
your
my heart doctor?
No.
Do I stop seeing?
You don't stop seeing all your doctors, but what we like to do is work together. What is the latest? Because that's the thing. Doctors don't work together. It's like they're all doing their own thing. And we've seen that so much in primary care was the neurologist is doing one thing, but wait a minute, they already gave me that medication. So they're doubling up on the same medication. So it's like we have to work synergistically together to formulate a plan.
Integrated team.
Exactly, for the patient. And with time, yes, we can probably taper a lot of the patients off the medications. We've had a lot of patients with high blood pressure with taking Synthroid, thyroid. They get on our thyroid medication. So it takes time, but we definitely can resolve a lot of the medical conditions that they were diagnosed with.
What about respiratory issues? Does that cover?
No,
that
not
as well?
really.
Okay.
Not really. Because unfortunately, respiratory is hello New York.
Oh, right.
Yeah.
We live where we live.
The environment, the climate, the allergens, seasons.
But to add, if you feel amazing, do you need 5 different doctors?
Right.
It goes back to you have to know your body. You have to know what a good blood panel is.
Absolutely.
You have to know that if I do a panel and there's not 5 thyroid hormones and my estrogen is not on there, my T is not on there, my cortisol, my DHEA, my ferritin, all of these different levels are not on there, it's not complete.
Right? We also have to know what it means.
Absolutely. But
a lot of doctors don't explain.
Right.
They don't break down. We take a lot of time with patients and explaining to them every single marker, what it means.
And what it means and what's the symptom associated to that, right? Because you can look at your labs. Here's another thing. We're so reactive when it comes to panels. Like we go and do labs when we're feeling like crap.
Oh.
Feel good then
And
do
then
labs.
take it. Okay.
Right? Because now you know, oh look, my markers are this. These markers, I feel good in here, because at the end of the day, where did these markers come from?
Correct.
8 million people in New York City that are feeling either all the way here, all the way here, right? You want to think, I want to be kind of right, and I want to be optimized with everything.
Not settling.
I don't want to be in the lower bell curve or the higher bell curve, but your doctor is only going to look at it when there's a little red,
Yeah.
a little red.
Alright. And I
Highlight.
had to rewire myself with that. I am guilty. I'm guilty again. Again, this was such a learning curve coming into a holistic wellness and seeing things from a different scope. And I'm like, oh, this is normal. Ingrid is like, huh? No. This is not normal. Wait a minute. This is not normal. I'm like, it's like basically like you said, until it's not like a red marker. We don't look at it. We don't worry about it.
You don't have to be flatline.
Correct. And we have
Before
to.
you start
Correct.
changing things up.
Exactly. So that's the conversation. It's like, okay, so you want to be pre-diabetic next year.
Right.
Instead, I want you to be pre-diabetic next year. I want you to have hypothyroid. I
High
want you
cholesterol.
to have next year. Next year, so I can give
Give you the
right,
medication.
right. It makes no sense. And again, it goes back to you have to know.
Yeah.
You have to know. It starts with understanding understanding your levels,
Your symptoms.
understanding your feelings, and listening to your body, and not allowing the man to dictate what it is for you as a woman.
Okay, you're crazy. Okay, that's what they like to say. Tú estás loca. You're crazy. You don't know what you're talking about. You're moody. We go through so
It's
much
just
as
in
women.
menopause,
It's
right.
sad.
Right.
We go through so much as women already. We are
Yeah.
mothers.
Yeah.
We are entrepreneurs. We're so many things. We have to be caretakers, caregivers. And then on top of that, we have to deal with this symptoms, this new level and chapter in our lives that's perimenopause and full menopause. There's no need to suffer. We don't need to suffer no more. Ladies, don't
There's an
suffer.
answer. There's an answer. Again, it's like my mom. I remember, and it's when I started to do this work. I remember when my mom was in her 40s. Like, I remember what my life was like. I was like in my early 20s, and she went berserk. She sold the house. We were off in college, and we came back home, and we're like, where's
my
all our
stuff?
things? And I'm like, you make these drastic
impulsive.
impulse changes. I used to see her like having a hot flash, or just, I saw the misery that it was for her, during your 40s, and it's like in your 40s, early 50s. And there was no answer for her at that moment.
Right.
But there is now, and we don't have to live like that. You don't have to have so many bad nights of sleep that you can't function anymore.
I haven't slept in. I
Girl.
haven't slept a good sleep in about 6 years.
Oh, what he will do for you.
Yeah.
Think about a man, right? So there's nothing that stops them from having a good night's sleep. Even if it's just 5 hours.
That's
5 hours, they wake up and they're good.
They're good.
That's what tea can do for you.
Wow.
It keeps you in that super deep sleep. Testosterone will help you just vitality, your sex drive. That's why they are always
The energy.
Wow.
Ready to go.
And for us during our cycle, the imbalance of estrogen, progesterone, and testosterone is what then increases our libido at certain times of the cycle. But if your T is always high, you're always high, just this, it's like an overall feeling of wellness, right? Anxiety. I've had clients tell me, girl, my kids, they think I'm on something because I just don't care.
Wow.
You want to touch the fire? Go ahead. That's your problem.
You'll learn.
Let me know. Like,
Right,
that's this.
right.
And that's all that
anxiousness.
needed to be fixed. Not to be on 3 anti-anxiety medications.
Exactly.
Right.
It's
So,
ridiculous.
Going back to mental health, our supporters from day one know that I have bipolar and ADHD and depression. So, and I've tried about 7 different medications to finally figure out the right cocktail. Finally there. Now I'm feeling like I'm going back down again. What do you say about that?
I mean, I think first it's labs, right?
Which I have not taken
Yeah.
at all.
We gotta
Now that
start
I'm
with
thinking
labs.
about it.
We start at the bottom. If you don't have, the first thing is blood work. We're not going to know nothing. We can sit here all day till the sky turns blue. And the first thing we tell our patients, we need a full panel. We need to look at the whole picture first.
Yeah.
Before we do any recommendations.
Because there's other, are you on birth control?
Yes, that too.
So you have another blocker that
Correct.
blocks your key hormones. On top of that, an SSRI.
On top of, the typical life stressors,
On top of lifing.
work, sitting around, all that.
So first is the panel, but my foundation is going to be what are your hormone levels like? The birth control. There's other options. There are no hormone IUD options.
Yeah,
Oh,
like the copper.
But your insurance doesn't cover that.
Oh, that's another thing.
And that's why
And it's
I did explore that.
It's the
That the insurance doesn't cover the copper?
The copper one, yes.
Are you gotta be kidding?
Yeah, that's another-
Are you gotta be kidding?
serious.
I didn't know that.
That was
no,
my
I didn't
first
know.
choice,
But
but
that's an
that's why I
IUD.
taken
It's
it.
not like a whole total different, type of. This is ridiculous.
here's with insurance is a whole nother. There's a whole
Right,
other thing.
right.
but
Luigi,
another one.
we need you.
It's a trap, right? But I invite you to think about what is the investment.
Right.
It's more expensive to not sleep for 6 years.
Well,
It's more
yeah.
if it costs
Preach,
me
boss lady.
$1,000 to get a no hormone IUD, and I'm gonna have this on for 5 years, do the math
Right.
daily.
I didn't even think of it like
You
that.
have to shift your perspective always when it comes to investing in yourself. Because I got a Chanel bag, so I can't.
That's even more.
You know what
It's
I'm saying?
more than
Like,
that. It's more than that.
I have I know patients that they're like, yo, I will sell my child before I stop doing my hormones.
Lord.
Because you have to look at it as it's my body. All right, well, this is gonna cost me $1,000, but you'll figure it out. $1,000 is a vacation. It's hair extension.
People get the money. When people want to get the money, they do everything except for putting their health in priority. If you don't have health, you don't have anything. You don't have the house, you don't have the apartment, you don't have the enjoyment of family. Your perspective has to change completely for you to start taking care of yourself.
Yeah, no, because there's just too many options. There's too many things out there, and insurance is a piece of crap.
Absolutely. Do you feel like I could ever get off of psychotropic?
Absolutely.
We've had patients.
There's protocols to get off.
Okay.
It's obviously it's a long road because just getting here has been a long road for you.
Yeah.
I know it's also scary for you because it's going backwards. Like it's a lot, right? But it starts slowly.
Okay.
And you would be surprised what just you making the decision mentally changes everything.
So
That's dating.
So I decide I want to take it. I'm no longer on the medication. Do I have to continue the hormones for the rest of my life to maintain that?
Yes. So you never yes and no.
Okay.
We
Right.
need hormones for the rest of our lives.
We will need hormones for the rest of our lives, right? You are in menopause forever until the day you die, right? It becomes a matter of what is life doing to you at the moment, right? Because
It's kicking my ass.
It's
right, it's like, hey girl,
It's
I'm on the floor, right? Sometimes you might have periods where life is ease and you feel like you don't need them. But again, I go back to my initial, it goes back to you have to feel
Yes.
your body.
Yes. Keep
And
going.
the multiple things or medications that you're on are not allowing you to let you feel your body.
Exactly that.
Right? So it's slow. The first thing I will tell you is the birth control is the first thing that's
Correct.
blocking you. Right? And then we look, obviously not for your bipolar, I'm never gonna, touch that. But in terms of the feelings, right? The depression, high, the birth control can cause. Right? So it's like slow and steady. But I know that mental shift and mindset is a really powerful drug. It's really powerful.
Absolutely.
Really, just once you decide,
Okay.
that makes a difference. It does. So yeah, but we'll definitely be on hormone stuff. I'm not going through none of this nonsense my mom went through. No.
Yeah,
No, for what? You see the skin.
You look
It's
great.
glowing. You're glowing. You're glowing. You don't need nothing else. You don't need nothing else.
Wait, so what you're saying is you get off the birth control
First, for you.
first,
For you.
right? You go on these hormones, and I don't need birth control anymore. Am I
Less. No, that is not true. That is not true. Hold on a second. Bioidentical hormones will not protect you against being pregnant. You can absolutely get pregnant.
Okay, so you still need some sort of.
It's more, yes, you still need protection, right? It's more of what type of birth control that you're on. So the copper, the no hormone IUD
Is the copper.
is gonna give you no babies, and it's not gonna give you extra hormones that are. It makes your SSRIs have to work even harder.
So
Think
what you're
about
saying is, I cannot stay on the hormonal birth control
Correct,
while
the Perimenopause.
taking the hormones.
You can, but and I'm saying this for you, right? This is
In your
this
case.
is your case.
Okay.
Because the goal, what is the goal? The goal is to get you on less meds and more balanced, right? For you, it's first is no hormone IUD, and explore BHRT, bioidentical hormones, right? And see that option. Traditionally, most women, right? Let's say you are not in full menopause until you go 12 months without a period, right? That can happen in your late 40s, early 50s. It really depends. So this entire time from right now, so since I've been 32 until whenever the hell my period goes away, I am just taking testosterone because I'm still producing estrogen. In 2 or 3 years, I might start to get estrogen because I'm not producing enough estrogen, right? But these are not, there's 3 types of estrogen. The one that we're working with is your estradiol. Then there's like the one when you're pregnant, the one on birth control pills, and progestin, the one on birth control pills and things like that. So, these hormones, when we come to BHRT, is not about reproduction.
Okay.
You can get pregnant. I've had pregnancies, because
Happens.
your sex drive goes back.
It shoots up to the sky.
Okay.
So that's why the copper IUD is just a nice
Better choice. In your
choice.
case.
In your case.
Gotcha. So
Very
every
good.
case is different.
Every case is
absolutely.
different. This is why they need a whole wellness, assessment beforehand.
Yeah,
Everything.
because for
So
other
you get
women,
you get your patient, you do all these things, you get all your results, and now, do you sit with us and
Everything.
all your recommendations step by step? This is what you need to do.
A whole program. And we offer the supplements as well, if it's needed. So everybody's different. Some women, depending on their age, some may need only T, some may need testosterone and estrogen and progesterone.
And
So
thyroid,
every case is different.
everything.
So what about all my hairy girls like myself? So I do laser for my whole face.
Very common question.
With hormones,
Very common.
hormones, laser.
Very common because there's so many women with PCOS. And PCOS they cause like excess hair growth. The thing is that women think, or many people.
And
humans
PCOS,
think, yeah.
what is polycystic ovarian for our viewers that don't know.
Polycystic ovarian syndrome, and it's very common in women. It's just a bunch of different symptoms that they want to put this word to make it easier to say. But you're not going to have, because this is side effects, right?
Okay.
You are not going to grow a beard.
Okay.
Absolutely.
That's
not.
everybody's fear. That's their first thing.
You're not gonna
They're like, oh my
I
God.
You're
spent
not.
so much money on this laser.
I know. I had a little extra chin hair,
No, I have a
like
whole
2 or
beard,
3.
like, a
But
whole
you're
one.
not gonna get a beard.
So do I still do my laser?
Absolutely. You
Okay.
continue your same thing because
Okay.
laser is just laser hair reduction. It ain't removal. No matter where you did it. That's a lie. That's what they tell you, right? And we do laser too, but it's laser hair reduction. We're constantly cycling our hormones. So if you started laser in your 20s,
I did.
in your 30s, you got to do it all over. It's
All
not
over
just
again.
I've been
like,
doing this for about 15 years.
Yeah.
And because my laser lady said, I will have to do this until I hit menopause.
Yeah, until your hormones stop hormoning, right? That's because of your T, right? The hair and things like that. And again, testosterone. Women, everybody thinks, oh, testosterone is only for men because we think testosterone.
Absolutely, yes.
Yeah.
We have more active testosterone
Than
in our
men.
body than men. We
Is that what I'm
need
so
more
Yes.
active
Probably
testosterone.
genetics and a mix of genetics and your testosterone.
Right.
It is. So it is. It's the more women have just more testosterone, but we needed more. We have more than men, right? So we can't be afraid of T.
And that's crazy. Like, I knew that I didn't know we had more than men. It's crazy. It's been a wealth of knowledge.
Yeah.
Yeah, I need my dosage ASAP. AS.
It's a process, and getting to that like that sweet spot again, it takes time, but you have to go into this as long term.
So how long would you say? About 12 months, 8 months, or it's case by case?
Everything is case by case, but most of our you feel it within 2 weeks. You're
Really?
like, oh, okay. We do
wow.
your
It's
labs
different.
again after you start to make sure. But here it goes. When I do those labs, it's like, how do you feel? Okay, great. That's it. I know you're good because it's a feeling. It's a feeling. Now, if I have a client that comes and they're like, I'm still not, my vagina's not, doing its thing, or I'm still not
Not wet.
sleepy, or, then I know right away that those labs are going to come back and they're not optimized.
Correct.
So what, do you increase the
Yeah,
dosage?
that would increase or give you something
Decrease.
else, whatever it is.
It
but-
depends. Everybody's a tailored. So we use BioT as a system. So people think, oh, you're just gonna implant hormones left and right. It's not that. We follow a BioT system. When we input the labs that we do for you, we input it in a system, and then that computes the dosage and the recommendations. We don't always go by the exact recommendations. Sometimes we tailor it depending on the patient's symptoms. So a lot of times we listen to the patient. Again, it goes back to what Indira was saying. It's how you're feeling. So yes, everybody is case by case.
And that's why it's bioidentical, right? This dose is created for you based on everything else that you're doing, right? And we'll put in there what type of birth control you're on, what medications you're on, and then they will right away, AI girl. But there's nothing like that conversation that they're having with Dr. M when they come in, and it's like, again, how are your symptoms, right? Are you super severe? Then I can't go by this, right? Because you have to put the
And a lot of patients, they don't even wait. They come back before time. They're like, I need my pellets. I need my pellets.
like, take your hormones. Absolutely. It's life changing. Think about a woman. Think about that woman. She's in her mid 40s, and she has 6-7-year-old kids, right? Because she waited until later. That woman went through postpartum and she's in perimenopause. Double whammo, right? In your early 40s.
It's sad.
And you finally start to get your life back, right? You finally start to feel like yourself. Are you getting off that? The minute that starts to wear off, you're like, girl,
Like never. Like they discovered. Go
right away, right
Is that
away.
okay, go.
And unfortunately, there are many cases where our patients have a GYN visit
Oh,
in between.
Oh no! Why you going there, Indira? Why you going there? Why you gotta take it there? Oh boy!
You have to go there because you have that woman that has that GYN or primary visit in between, where they go to their doctors and the doctor sees, oh, you're on what is this, right? And then they tell them, what is this? This, you shouldn't be on this. Da 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 da. What are you doing? This is dangerous. This is this. That doctor went to med school with that initiative of 20 years ago that said cancer is bad, right? But it was flawed. It was a flawed study. The women in that study were already predispositioned to get cancer. So how are you gonna? This doesn't make sense. And 2 years ago, under President Biden, they redid that initiative and said, "Oops,
We made a mistake.
we made a mistake."
They make no mistake. They know.
So women's health for the last 20 years has been dictated by a flawed study, and that's why you don't hear about this conversation enough, right? It's not happening. That's
Well,
our
I've
aunties
never
did.
heard of this
Never,
until-
never.
Well, now Halle Berry, Oprah, they're having these seminars when you've already been practicing this with Dr. Sophia Lubin. She's our OBGYN and she's amazing, a powerhouse.
Oh, you have
And
that in the clinic
yeah,
too?
yeah.
Okay.
She's our medical director and she's been working side by side with Indira for the past decade.
Yes.
And this is some of the myths and things that they come with a lot
They
of
used to call
women.
her- when we first started doing this, some of her colleagues used to be like, you know, witch doctor, what are you doing over there? Da, 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 da,
Yeah.
This is bad.
It was frowned upon.
And now her colleagues come to us to get their
The
pellets.
pellets.
Like,
Yeah, it's crazy.
You know, they're like, oh, okay, let me not jump off a bridge.
That's the
You
good
know?
thing. People are finally waking up. They're finally doing the research. They're finally doing the studies. They're finally taking the time to say, wait a minute.
You don't have to live like this.
Wow.
Female, you don't have to live like this.
This
Woman, you do
This
not
is a
have to.
life. This is a game changer.
It's everything.
It's everything.
And it's
We're
not-
controlled by hormones.
and
Everything
it's-
is hormones.
Yeah, and it's not for old. It's not for mom. It's
Yeah.
for you. After the age when you turn 30, you already starting a little crazy. Not everybody, right? Because if you
most
had a
definitely.
beautiful lifestyle, you worked out, you know, you did a good lifestyle during your 20s. Not much. I was in the club, right? I was having, but lifestyle matters, right? Because
Of
I will
course.
have that. I will have that
Absolutely.
patient who's well in her 50s and she feels amazing. And while even though her hormones say that she doesn't need, like she needs, but she feels good. So at that point, you're doing hormones for longevity. It's the protection. I want to continue to make sure that is had.
Absolutely.
Right? Because just in the last 3 weeks, I've had maybe 4 men that I know die of a heart attack, less than 50. We're losing our
But we see that all the time.
hormones.
People just dropping and we're like, what's going on?
Right.
It's your
What
hormones.
happened? This
It's your
person was
hormones.
going to the gym, eating right. We have a lot of friends and colleagues that they're like, what's going on with me? I have this hormonal acne. I have this mood. I don't feel right. Something is not right. It's your hormones. You're not going crazy. You're not alone. Your doctors is not telling. It's just they're not doing what they're supposed to be doing, unfortunately.
They're not. Well, I mean, insurance, right? 15 minutes.
Yeah.
It is.
Unfortunately. We need 2 minutes. 2 minutes.
Especially with the financial climate that we're in.
It's terrible.
You know, it's hard.
It's terrible. It's terrible.
Okay, so let's say a patient, a lot of our viewers, a lot of people, they want to know more information. How can they get hormone replacement therapy?
So the process really starts with, as we've mentioned, it's the labs, right? To get an idea of where you are. This is bioidentical, right? So we use your labs to create what is going to be your dose, right? Whether it's your pellets, your progesterone, and hormones, they come in many different ways.
So everyone's hormones, everyone's dosage is
Be different.
Absolutely.
Everyone's.
Everyone. And so it can be pellets for you, it can be pills, it can be patches, it can be creams. And there's different types of hormones, right? Your synthetic and what is bioidentical. Synthetic is when you think about what like men inject at the gym, right?
We don't do that. We don't do that.
Okay. That is horse testosterone. It is terrible for you.
Yeah.
Many of those men will suffer from ED as they continue that type of hormone. And then we have bioidentical. It's in different ways. And the reason we like pellets is because pellets are going to give you a nice consistent dose for 4 to 6 months. Right? If you do a patch, you have to do it
It comes off. A lot of patients don't put it back on.
Yeah, put it back on if it falls off. Because your hormones are, so there's the creams, you have to change it around. So pellets are just easy for today's day and age. You get your insertion, you're done. Not everything will be in pellets. Yeah,
really inserted.
It's
Yes.
like the size of a rice.
yeah. We put a little rice grain. It goes right in your in your
Buttock
upper
area.
booty. The procedure is super quick. Dr. M kind of just makes an incision,
I thought
drops
it
it
was
in there. It's not painful.
A needle.
It's like a little.
Okay.
It's super quick.
very
It's not
simple.
painful.
Okay.
It's like a 10-minute procedure. And then again, based on your cardiac output is when that is being used over a period. Like we have clients that they'll do hormones to run the marathon.
Okay.
But obviously those hormones are done in a month, right? Because you want to use that vitality to be able to work out, to be able to, testosterone helps you build muscle,
Absolutely.
right? So you're like, you have that edge, but the marathon training for it, you're running your cardio, your heart. So that they use them up faster. So it's based on your lifestyle that how long it's gonna last.
Wow. So you will see a change in your physical body.
Oh, absolutely. You're more motivated. You're gonna go to the gym. You're gonna work out better. You're more like your clarity, your
Focused.
mental clarity. You're focused.
A lot of women that want to start losing weight start losing weight. You know, it just starts coming off because the problem was the hormones. It was never fixed.
When you weight gain or inability, all of that is a side effect of feeling shitty.
Yeah, it's literally
When you feel good, you don't go have the burger.
Right.
You eat bad when you feel bad. Right? Don't talk to me. I'm depressed.
yeah.
I'm gonna have my Shake Shack. Right? But if I'm feeling good, I'm gonna naturally want better things. You know.
So that craving is no longer there.
It goes because you feel good. You know, again, you order bad things, you do bad things.
You're binge eating.
And then on top of that, obviously, there's a lot of other things that we do at My Wellness Solutions. You know, the foundation is always detoxing. It's always hitting the reset button.
Absolutely.
You know, I'm not going to have anybody start hormones when your body is toxic as F. You know, it doesn't make sense.
It doesn't.
That's why I was telling you, for you, I would go, like, your plan would be, I'm going to go do a
Full panel.
full detox.
Okay.
You're going to go full cleanse mode for a few weeks. You're going to start to feel better just on
And
that.
that's what I like about your program. It's not, okay, let's get you on
No.
semaglutide. Let's get you on the hormones. No, she's like, no, we're not doing that. We're going to let's see what your body does first. Naturally. And that's what I love about your
Yeah.
programs. Even with my friend, that's how it was. You were like, she's like, oh, let me just get the semi. I'm like, she's like, no, let's see. Because maybe you might not even, let's see.
You might not need it.
So when you say detox, is that something that you give the patient to
Yeah,
help
so
the
it's through
detox?
supplementation. It's
Got
through
it.
the services that we do. It's through the food. It's through your mind.
That's what I love about also, it's that we're like a one-stop shop. If you're having any side effects of whatever, we got the facial. If you got the hair, we got the laser. If you got, we have it all. You don't have to go anywhere else. We take care of the whole body, mind, and soul.
I love that.
Absolutely. So I look forward to working with you.
Yeah.
Yeah. When's your next open?
Sign us on the website.
So there's so much still we have to cover for hormones. We're definitely going to have more episodes covering this. This is going to take forever. It's not one.
We got 20 years of education to unlearn, you know, and these conversations, they're gonna be they need to be had because we need
that
ones who
awareness.
need
Yes.
them. They don't need them.
Yeah.
They don't
Amen.
need them.
Amen to that. Stay tuned, you guys, for more information, for webinars, and more education on hormones. And we want to thank again so much, Indira, for your time and your knowledge and your words. And thank you so much for your continued support and help to the community.
Thank you.
You've changed lives, one hormone replacement at a time.
Awesome, really. I love it. Thanks.
Tell us
Thank
where you are
Thank
located.
We are on 2116 in Frederick Douglass in Harlem.
Oh.
You can check us out at MWS Health or visit our website, mywellnesssolutions.com.
Yay! Thank you so much.
Thank you.
See you soon.
Thank you.